I'm taking you on another walk for a cardiovascular health talk. Let's go over lipids or cholesterol today. When you get your lipid panel checked, ideally you want to do it fasting. Typically I tell my patients to go in the morning before they eat breakfast. You don't have to do a particularly prolonged fast. Normally the night before it's completely fine, and you can usually have water, and black coffee or tea is also typically okay before the test. Your results are going to come back with several numbers. So you'll have your total cholesterol. Typically we like to see that below 200. Then you'll see your HDL. HDL, you can remember H for healthy. We generally consider more HDL to be protective of cardiovascular disease, meaning higher HDL equals, in general, less cardiovascular risk. For men, we like to see HDL above 40, for women above 50. Triglycerides are also measured as part of your lipid panel. Those should be less than 150 generally, and higher levels of triglycerides are often associated with either not fasting before the test or conditions like prediabetes or diabetes, so often like elevated sugar. Finally, the one that we generally pay the most attention to is your LDL cholesterol. LDL is what we refer to as bad cholesterol and is the one that is most significantly associated with negative cardiovascular risk, meaning higher LDL equals greater risk of things like heart attacks and strokes. Most people should aim to have an LDL of less than 100. For people who have greater risk of cardiovascular disease, so conditions like diabetes or a previous heart attack or stroke, we like to see that less than 70 and sometimes even less than that. Sometimes we can reach these goals for LDL reduction with lifestyle alone. A lot of that will depend on the individual's medical history, their capacity to make lifestyle changes, and their genetic predisposition. Some people are genetically predisposed to hyperlipidemia or high cholesterol, and lifestyle can make an impact on those numbers, certainly, but it may not be enough to overcome the genetics, and that's just going to be a very individualized thing. I plan to talk with you guys a lot more about this topic as well as others, so follow along for more. And if you have any questions that you would like me to cover right now or in the future, feel free to message me or comment below.